Okay, so I am live on Instagram, I'm live on YouTube, and I'm live on Facebook tonight. And I'm so excited to be here with you guys tonight. I'm going to be talking about joining the orgasm revolution. And today is the first day of the orgasm revolution, and I can't wait to tell you about it. Basically, what it is I'm bringing awareness to the orgasm gap. So before I go into all of that, I'm just going to introduce myself. My name is Eve. I am the host of the podcast called Please Me. And I am, I've had my podcast for about 8 months now. I'm in season 2. We did 20 episodes of season 1, and each one of them was amazing. And I'm halfway through season 2 now. And each episode has been a little gem and a real labor of love for me. I've been enjoying it. I've been interviewing a lot of really amazing women and men. And my podcast aims to destigmatize conversations about sex and sexual health. So, with that being said, I like to talk a lot about the orgasm gap. And the orgasm gap is a phenomenon that happens in heteronormative relationships. So, with a man and a woman, and where women are not getting their pleasure needs met at the same rate as men are. So 95% of men get their pleasure needs met by being able to reach climax with penetrative sex and with coupled penetrative sex. And women, on the other hand, are only able to get there 65% of the time in coupled penetrative sex. And this is one statistic out of many. So when you're talking about hookups, the orgasm gap exists all the way through marriage. The orgasm gap exists, and it exists in every single relationship type that's heteronormative, from hookups to marriage and everything in between. And so my purpose with the podcast is to destigmatize conversations about sex, so that women can get their pleasure needs met. And I talk a lot about communication. I talk a lot about how to bring your partner in to wanting to tell them what you like in the bedroom. And so we talk a whole lot about different things on the podcast: being present in your body, body positivity, self love. These are all topics that come up on the podcast. And we go into a different topic each week or multiple topics each week. And I explore with the guest all about those topics. And so I want to just encourage you as you're listening here to, ask questions as you feel, fit to. And I'm happy to, answer any questions that you have, or just have a chat back and forth about, what I'm talking about. So let me just see if there's any questions over here. Okay. I can't seem to close this now. There we go. Okay. So just going to get my list here. So the reason why I like to talk about the orgasm gap, and I usually mention it during each podcast, at the very end of the podcast, I typically ask my guests what their favorite sex position is. And the reason I really like to ask that question is because I like to assess whether the position that they choose is one where you can externally stimulate the vulva and the clitoris. And that is how women climax. 95% of women need clitoral external stimulation in order to climax. Only 3 to 5% of women can climax from penetration alone. So that is a very interesting statistic, and very different from what you see when you're watching movies, when you're watching shows, and when you're watching porn, right? Because what we see is penetrative sex. And penetrative sex is great. However, it is how men climax, and very few women can climax from penetration alone. So, I like to talk about different sex positions because I like to be able to talk about how we can, stimulate externally while also having penetration in order to get closer to closing that orgasm gap for yourself. And so, we talk about all different sorts of positions. Maybe we'll talk about some of those tonight. Does anybody out there have a favorite sex position that they want to talk about? So make sure that you put it in the comments, and I'll be able to see it and we can chat about that. But each week I have a different expert on the show. And this season I've had incredible guests on the show. I've had guests that are in the swingers world, in the ethical non-monogamous world, in the kink world, in the BDSM world, a lot of coaches who do coaching for resilience and for loss. So I had somebody on the show actually last week, and her name was Sarah Webb, and she was a resilience coach, and she talked a lot about, how she helps people with breakups and how to get over their exes. And she targets the LGBT community specifically because she belongs to that community. And it was a very interesting story. I definitely suggest that you go back and listen. She actually was married to a man and divorced him and came out after having a child. And her story is very powerful and very inspiring. And I just really enjoyed it. And I think you will too. So, go back and listen to that episode. And I've had tons of great guests. I'm going to see if there's any questions. Okay, so I had a comment on Instagram about someone enjoying a sex swing. So, sex swings can be really fun. I don't know if anybody out there has one, but you can do a lot of different things with them. So the sex swing itself is a lot of fun because the person that's in the swing is suspended. So you can really face either direction, facing forward like missionary, right? Or facing backward, more like doggy style. And so the sex swing can be, a really great tool in your toolbox of sexy toys to enhance your sex life. So, either one of those positions in the sex swing can be done with and use. You can use a vibrator or your hand to touch yourself at the same time as you're receiving penetration, and that could really enhance your sensual pleasure and hopefully bring you closer to orgasm. So those, the sex swing is a really great tool. Not a lot of people have a sex swing in their, room or, but, being suspended is quite a lot of fun. And actually, Julietta Chiara, who was in episode 4 of this season. She was also a guest in season 1. She is a Shibari coach, and she ties up people for a living. So she does the Japanese rope tying, and she teaches that, and she coaches. She also does coaching, and so she was a really fun guest to have on. And so I really, really recommend you go and listen to her episode. That was a really fun one. We talked a lot about penis size during that interview, and whether you're a grower or a shower. And we talked about the difference between the two, which I thought was really interesting. And that was a really fun conversation. Does anybody have any other questions about different sex positions that you like? So another thing that I'm going to mention here is that 80% of women say that they have faked an orgasm sometime in their life. 80%. And what that does is it teaches your partner that you like what you like what you really don't like. Okay, you're giving them positive reinforcement for a negative behavior. So that's the worst thing that you could possibly do is fake orgasm. It's okay to say that you didn't have one. It's not the end of the world. But honesty is the best policy when it comes to this particular situation, because you don't want to teach your partner what you don't like and have them repeat that over and over again. So I always say that, aftercare is the perfect time. So aftercare is the part of sex after the fact, right? After you're finished. Sometimes there's like a period in between. You may be having 2 rounds, and there might be a little period in between of aftercare where you're cuddling and you're connecting with your partner emotionally. And this is a perfect time to bring up these conversations about what you liked and what you didn't like. And really focusing on the positive stuff and not tearing down your partner. You don't really want to bring up, oh, I didn't like this and I didn't like that, because that could really, make somebody feel bad. But, the things that they really did do well and you really did like, those are the things you want to point out so that they can do that over and over again. So what are some fun things you like to do in the bedroom? I would love to hear what turns you on. So faking it is no good. This was another interesting fact. 45% of Americans consider themselves kinky. So kinky is just, thinking outside of the box when it comes to sexuality. And really, Julieta Chiara puts it a really good way in the episode. She says, that what really is thinking outside of the box, what is really outside of the norm. I mean, there's no rule manual saying this is normal sex and this is abnormal sex or out of the box sex, right? It really is, no manual that tells us what is right or wrong. So we really do determine that on our own. So what might be kinky for one person might be completely normal for another person. So it really is self-defined. But, having creativity in the bedroom is a way to keep it fun and exciting. And, since sexuality and sex is the way that adults play, having creativity in the bedroom really makes it a lot more fun. So let's just see if there's anybody that is commenting. Oh, the Matrix. So the Matrix is a position. I don't know if anybody else has heard of this position, but I will describe it. So the female partner, and I guess this can be done with two male partners, or with two female partners, with the female partner that's on top having a strap on. So it can be used, in heteronormative or LGBTQ sex, right? But basically, the person that has the penis is on top, and the person that doesn't is on the bottom, and or that's going to get penetrated, I should say, is on the bottom and facing down. And so the person that's on top is laying on top of that person, but facing their feet. So the penetration goes in at an angle that is quite nice. So I definitely recommend you trying that out. It's called the Matrix. Now, the Matrix is a position that is kind of hard to stimulate the clitoris unless you prop your body up on some pillows to give yourself some space between your body and the bed or the surface that you're laying on. So I would say prop yourself up on some pillows, your hips up on some pillows, so that you have a little space, so that you can reach down and your hand can have some space to move, or you can be holding a vibrator to give that external clitoral stimulation. Because like I said before, 95% of women need external clitoral stimulation in order to orgasm. So, when you're having that penetrative sex, also stimulating externally is going to help get you there much faster than, without external stimulation. Because if you don't have it, a lot of times you won't ever reach orgasm, because only 3 to 5% of women can reach orgasm with penetration alone. It's a very small percentage. So if you're out there and that's you, lucky you. I can say for sure that that's not me. I definitely need external stimulation alongside of penetration in order to orgasm. And I think that I'm definitely in the majority because 95% of people or of women need that. So that is the Matrix. And I would love to hear if anybody else has any other examples of positions that they like. What's your favorite sex position? So I want to talk about the orgasm revolution. So today, I've been going live off and on all day talking about the orgasm gap. And I am going to jump on in just a second. I'm looking for something specific. One moment, please. So I've been going on live all day today and talking about joining the orgasm revolution. Okay. I want as many people to join as possible. And basically what that is today is the first day of the orgasm revolution, but it's going to be ongoing. And what you're going to do if you want to join the orgasm revolution to bring awareness to the orgasm gap is you're going to go to pleaseme.online and you're going to purchase a t-shirt that says orgasm equality on it. Okay. This is one of the t-shirts from my Please Me store on my website. And you're going to take pictures of yourself wearing your t-shirt, and then you're going to post it on social media. And as people's pictures come in, I'm going to be reposting them. So make sure that you tag me so that I can, repost your picture. And we're going to bring awareness globally to this issue, because this issue is an issue across the board. It's not only in one country or another. It is in all heteronormative relationships, and so it's super, super important for people to understand that, women orgasm differently than men. And, penetration is the way that men orgasm, but not necessarily the way that women orgasm. So you should go to pleaseme.online if you want to get your t-shirt, and you'll see lots of other fun swag on there as well. But definitely, to join the revolution, get your t-shirt, and then post some pictures. Post a picture of yourself wearing it, right? Be creative. Do it on the beach or wherever you want to be. But post a picture of yourself wearing it, and then tag me on social media, and you will have joined the revolution. And I will be, talking off and on about this. This is really a topic that I think is super important for everybody to understand. So I will be talking more about it. So when you see me live, jump on and ask a question. I want you to tag me on social media if you get your t-shirt and you post pictures. Make sure you tag me so I can repost. Right now I am on Instagram. My Instagram is right there. It's Please Me by Eve Creations, and there's a period in between each letter or each word. On Facebook, I'm Please Me. And then on YouTube, I'm also Please Me. And on TikTok, I'm also Please Me. And you will see my little, right here, my little Please Me sign. That's the art for the cover of my podcast. So you'll see that on all of those sites, and you'll know that that's me. And so please, join the revolution. It's going to be a lot of fun. We're bringing awareness to the orgasm gap. And if you want to talk to me directly, there's also a way to do that. So you can reach out to me on pleaseme.online. You can also reach me on the OWL app. And the OWL app is really interesting. It's something that I actually just recently started using. And it is an app where you can call people that are experts in a field. So there are many different types of experts on the OWL app. And, you might have a question about something, and you might want to have a, 10, 20, 30-minute conversation with an expert about that topic in order to decide what you want to do, or, bring more awareness to a certain topic that you're curious about. So I am on the OWL app, and you can ask me about all sorts of things. I am a licensed physical therapist, and I treat conditions of the pelvic floor and sexual health conditions. So I treat erectile dysfunction, I treat incontinence, I treat decreased vaginal sensitivity and dryness. I treat painful sex. Those are some of the conditions, among others, that I treat in my physical therapy practice. So don't be shy and say hi. Make sure you go on to pleaseme.online. You can reach out there and I'll receive an email, or you can call me on the OWL app. And right after I go live here tonight, I am going to jump on the OWL app for a little bit. And if anybody wants to give me a call, I will be available to chat tonight for a little bit. So I just want to mention, let me just see if there's any other questions before I continue chatting away here. Okay. Any other questions that anybody has, I would love to hear. So I'm going to talk a little bit about the treatment that I do for erectile dysfunction and decreased vaginal sensitivity. It's called acoustic wave therapy. And acoustic wave therapy is really the gold standard in treating erectile dysfunction. And the reason I say that is because a lot of times you'll go to the doctor and the doctor will prescribe you Cialis or Viagra. And a lot of people think, well, that's the gold standard because it's the first thing that doctors do, right? But that is really just a Band-Aid that is covering the problem, because erectile dysfunction is not changed by Cialis or by Viagra. what that does is it opens up the blood vessels, but the blockages that are there are still there. It doesn't break up the blockages in any way. So as time goes on, those blockages get more and more, blocked, should I say, and the blood vessels in the blood vessels, and then you end up not having any blood flow. And when you have no blood flow, you're not able to get an erection. And the way that that affects women, because the clitoris and the penis are comparable, it's the same spongy tissue that makes up both, is that, as women get older and their blood vessels get blocked, they start to experience decreased vaginal sensitivity and dryness. So the treatment is really for both of those things. And it is an amazing treatment. What it does is it allows the blockages in the blood vessels to break up and to flow away. So your body cleanses out those blockages. And then over time, it creates more capillary formation. So capillaries are the very small blood vessels in your body. And so if you're creating more blood vessels over time and you're unblocking the blood vessels that are blocked, you are creating much more blood flow. And as most everybody knows, a penis gets engorged because blood flows into the penis and engorges it, and it makes it erect. And what a lot of people don't know is that the clitoris also gets engorged. Blood flows to the clitoris, and that's what causes the blood to the plasma of the blood to seep through the vaginal walls to increase lubrication in the vagina. So that is one of the ways that that women get wet. And so if you don't have enough blood flow, you're not going to have enough wetness. So this treatment treats both of those conditions. And right now I am doing a special price for the acoustic wave therapy. I am offering buy 5, get 1 free. Okay. And that is a savings of $350. And it is an amazing treatment. And the reason why that amount is really important is that 6 visits is the amount that I recommend for prevention and for turbo boosting your erections. So you may not have any issues with erectile dysfunction, but you want to prevent issues. Or maybe you're just seeing slight changes in your erectile function and you want to turbo boost your erections. This is the treatment for you. Now, I recommend more of those treatments if you have mild, moderate, or severe erectile dysfunction. But 6 is the magic number for treating conditions that are, that you for preventative purposes. And so reach out to me if you're interested in that. If you want more information, you can reach out to me, or if you want to schedule an appointment, I would be happy to see you. This is what my livelihood is. This is what I do. And I love helping people to increase their sexual function so that they can have a happier life, because, sexuality, sexual pleasure, it's part of relationships, and it's part of what makes us feel amazing and happy. It brings happiness into our lives. So I definitely, recommend you trying it out if it's something that you are interested in. And I like to say that there is absolutely no shame in there's absolutely no shame in getting help for sexual dysfunction. It happens to many, many people. 20% of men in their 20s start to have problems with erectile function. 20%. That is a very high number for people in their 20s. You think that people in their 20s, aren't going to have any sexual dysfunction, but it is even common amongst people in their 20s. And that number goes up by 10% per decade. So 30% in their 30s, 40% in their 40s, 50% in their 50s. I mean, these are really high numbers. It's super, super common for men to have erectile dysfunction, and nobody's talking about it. Everybody's covering up with Band-Aids, taking Cialis, taking Viagra. But then what happens when those things stop helping? That means that your blockages are really, really blocked and you're already in the severe zone. The best time to treat erectile dysfunction is when you're in the mild zone. So the less, dysfunction you have, if you're starting to have any issues, that is the time to treat, because you're going to have the most benefit at that time. So don't wait until you're too far gone, because you may not be able to get your function back. And who wants to go through life without function, especially sexual function? So, make sure that you are taking care of your health in all ways. A lot of people go to, their regular doctor, but they, will skip, their urologist about erectile function, because it's, maybe not top of the mind, but it should be, because sexuality is so important in relationships. So let's see if there's any other questions. Okay. Well, I appreciate everybody who came on tonight. Thank you so much. I'm going to close up now for the night, but please reach out to me on pleaseme.online or call me on the OWL app. And also follow me on Instagram, follow me on Facebook, follow me on TikTok, follow me on YouTube. And my podcast called Please Me comes out every Wednesday. And every Wednesday I have a new topic and a new guest who comes on and talks to me all about some type of, conversation regarding sexuality or sexual health, or sex itself. So all of the conversations are really fun, and we try to keep it classy, but, we are definitely enjoying ourselves, laughing and having a great time. And I would love to have you as a listener. So please feel free to, listen in, and you can go on to any site that you can listen to podcasts. So it's on Apple, Spotify, Audible, Listen Notes, anywhere you can listen to podcasts, you can find me. And if you want to view the podcast, which I always think is even more fun because you can see how we're interacting, you can go to my YouTube channel. I have all the live videos on there, and you can also go to pleaseme.online, which is my website, and I have the live, the videos, I should say, the video recordings of the podcasts on there. Not live. They're not live. I mean, they're pre-recorded and then they're edited. So I can be clear about that. So definitely, check out the podcast. It's a lot of fun. And, visit pleaseme.online if you want to support the show. Any support is helpful. You can also go to Buzzsprout on this website and support the show as well. And any support is always helpful. Podcasts are labors of love, and they do cost money to make them. And it does take time to establish, making money off of them. It really is something that not a lot of people do. So I'm learning how to do that. I'm in season 2. But, any support is helpful, because it costs me, to make these incredible episodes for my listeners. And I would appreciate your support. So I just wanted one last time, invite you to join the Orgasm Revolution and to bring awareness to the orgasm gap. Again, where women in heteronormative relationships are getting the short end of the stick when it comes to orgasms. 95% of men, are orgasming, and only 65% of women are orgasming. So, with education, with communication, and with us talking about this, and really making it something that is really common knowledge, we will be able to close our own orgasm gaps one person at a time. So that is my goal. And so I invite you to join the Orgasm Revolution. Okay. And I think I mentioned before, the way to join the Orgasm Revolution is to go to pleaseme.online and get your Orgasm Equality t-shirt. And then when you get it in the mail, you take some pictures of yourself wearing it and you post it on any of your social media and then tag me. And I will repost it, and you will have joined the revolution. And I cannot wait to see how big this grows. I hope that it's all over the world, because really this issue is a global issue. So please join us on the Orgasm Revolution, and please listen to my podcast called Please Me. I hope that you enjoyed this tonight, and I will definitely be seeing you live on another day. Have a great night. Until next time.